Many women above 35, actually they find sometimes so difficult to get pregnant and other things, you know. Now, the truth about fertility after 35 years, this is all about this video. And each and every woman should be actually know the truth about infertility, about fertility above 35 years of age. You know, many women actually today they choose to have children later in life, and this is because of maybe education, you know. This is because of their career, personal reasons. Now, while pregnancy after 35 years is common, and often health, fertility naturally changes with age, you know. So now let's understand what actually happens in these 35 years of age. One, the fertility gradually declines, you know. The number of eggs, you know, quality decrease with age, making conception more difficult. When you are born, there are a lot of eggs in your body, the ovaries, you know. But again, as you get old as a woman, they decline. The qualities, the number decline. And therefore, conception now starts becoming another problem in your life. The other thing is the risk of miscarriage, you know, they increase. What happens is actually the eggs quality decline, you know, the chances of miscarriages also increase. So you find yourself having some miscarriage each and every time. Maybe you are above 35, you are 36, 37, 40. Now the miscarriages are increasing each and every time. Each and every time you get pregnant, you have a miscarriage. You know, it's just a risk factor of the age. The other thing is the risk of chromosomal abnormality. You know, these abnormality issues, the chromosomes, you know, with age, they increase. What happens is that there is Down syndrome increases as the maternal age increase. You know, examples of Down syndrome, there are chromosomal abnormalities, not only the Down syndrome, but other chromosomal abnormalities, they increase with age. You know, pregnancy complications also they increase. That's what actually happens above 35 or after 35 years of age. So these pregnancy complications actually increase. You know, you find one having some gestational diabetes. You know, this preterm path cesarean section increases now. You cannot give, you know, you can't deliver on your own. You need to be to undergo cesarean section. The other thing is hypertension in pregnancy. They actually come in during at this age. So these complications come in as you grow older. The other thing, it may take long time to actually conceive, you know, because compared with young women at 20s, 25, you know, it after takes longer, you know, it often takes longer and become pregnant at the age of 35 and above, you know. Now, how do we improve this fertility? One, maintain health weight. You're above 35, you're a woman, you want to get pregnant, you want to avoid these complications, maintain health weight. The other thing is eat the balanced diet, you know. Don't take a lot of carbohydrates, leaving proteins or other issues. The other thing is exercise regularly, moderate exercise. The other thing that you can do is to take folic acids before pregnancy. You start them earlier, you know. The other thing is avoid smoking, excessive alcoholism, you know, recreational drugs. These might also increase the chances of chromosome abnormalities, you know, pregnancy complications, you know, taking long time to conceive. All this, seek medical earlier. If it happens that you are 35 years of age, you are taking a long time to conceive, you want a baby, go to the hospital, book a clinic, see the gynecologist, have a consultation so that you can be able to get more knowledge on how you can conceive. Now, if you find this video so helpful, again, please like, subscribe, share, with your family, friends, and remember to follow Health Talks in our Facebook page. This is the hand.